All right, everybody. Dr. Zach here with Aspire Health Clinical Chiropractic. I brought Alexa here. She's going to help demonstrate some things today, and what we're going to be talking about is going to be upper cross syndrome, and it's going to be shoulder pains and discomforts that you may be experiencing at home. Today, what I want to kind of dive into first was going to be the shoulder. A lot of people have shoulder pain right here. It's kind of this sharp thing that seems to come and go, and it gets a little bit worse after they lift heavy things up or whatever the nature is of that component. There's going to be two muscles usually involved. One of them is going to be the biceps tendon, and that runs all the way up into this region here. The second one is going to be the subscap, which is under the shoulder blade here, and that wraps around in front here. That is a lot of the internal and external rotation. Both of those muscles attach into this spot here where you have sharp pain. And what we're going to do today is we're going to demonstrate some exercises and some stretches that you can do at home to help relieve any of these symptoms that you may be feeling. Just a disclaimer, if you do these things and it does get a little bit better and over a period of time it does come back, I would definitely check out some healthcare professional, where it may be chiropractic or physical therapy, and just try to get a second opinion if these symptoms don't seem to go away over a period of time. So first thing we're going to do is going to be talking about scapular mobility. So I'm going to have you turn around, please, and we're going to have you turn just like this and have your arms up, just kind of like you're doing that wall angel. And we're going to bring your arms up and back down. As you can see, the scapula or the shoulder blades here move. One more time here. They move out and then they come back. A lot of what happens with shoulder pain, you can turn around there. A lot of what happens with shoulder pain is the mobility of the scapula or the shoulder blade slows down or becomes less mobile, especially on one side or the other. This exercise is going to help, these two exercises are going to help with the mobility of the scapula to help unlock the shoulder. Because a lot of people don't understand the shoulder is this thing right here, but you also have the other component back here. Usually this part slows down and it causes a biomechanical loading system, which is going to cause an improper motion of the shoulder in this direction here. So you have to get this moving in order to help this most of the time. So this exercise is going to be called a wall angel. Most of you have probably heard it before. Alexa's going to demonstrate it. If you want to put your back against the wall. And it's essentially going to be the same motion that we just went through here. What you want to do is you want to go back up against the wall, put your shoulders back, arms back to whatever they can, and then you just go up nice and slow all the way up and all the way back down. So this is going to provide a lot of mobility for the shoulder blades, in the sense of it uses a lot of the muscles and it turns a lot of things on and turns a lot of things off. So that provides a more of a stability component for the shoulder muscles, if you will. The next thing that we're going to do is going to be something similar with the scapula, and this is a shoulder blade. This is a scapular push. And what this is going to be is basically your hands are going to be up on the wall just like this, and you're going to push the wall away by keeping your arms straight. So if you could put your hands here, and what you want to do is you want to rock the entire torso in and bring the shoulder blades back. This one's a little bit more of a difficult movement, but as you can see, when she goes in, all of the shoulder blades come around, and when she goes back down, the shoulder blades come together. Notice that the arms aren't moving, and there's nothing really happening other than the shoulder blades coming back and forward. So you can come up from there. And the final thing that we're going to do, and this is going to be a stretch that you can do at home, it's going to be internal and external rotation. Today we're going to demonstrate a little bit of an external rotation, just because a culprit of this sharp pain that you usually have in the front of your arm there is going to be from the subscap. And that attaches in the back of the shoulder blade, and it comes around front like I talked about before and attaches right here. So a good way to stretch that out is actually to open this arm up. So we're going to go ahead and open this door here. And I have you swing around there. So the main thing that you want to do is you want to bring this shoulder down to about 90 degrees here. And then once you get comfortable there, what you're going to do is you're just going to kind of keep your body nice and straight and just lean away from it. And you should feel a little bit of a pull in this region here. And my recommendations for this is going to be at least 45 seconds, 2 to 3 times a day. What that's going to allow you to do when you do any form of stretching, you have to stay in the stretch in order to gain the physiological properties. What does that mean? In order to actually do something and benefit from stretching, you have to stay in the stretch for around 1 to 2 minutes cumulative. And as far as the mobility exercises go, I would say about the wall angels, 5 of them nice and slow is a good warm-up, and the same thing with the scapular push. You can do about 15 of those. If you do these 3 exercises and stretches, basically what it's going to do, it's going to allow the integrity of the shoulder complex to become restored over about a 2-week period. So if you start to feel and relieve some symptoms there, you're in the clear. Take care of your body. If the symptoms persist, like I said, reach out to a healthcare provider, and they'd be more than happy to take a second look at that. So Alexa, thank you so much.
You're very welcome.
Awesome. So thank you guys.